I'm 23. I work also as a tutor at the University of Sydney, tutoring about 100 students in international relations. But my involvement with Inspire began at the end of 2009. My research supervisor put me in touch with the head of research and policy at Inspire. Firstly, that guys are avid users of technology. They are able to list all the different types of technology that they use day to day. They spend a lot of time on the internet. They follow up on their cultural interests online. And they also use YouTube a lot for entertainment purposes. That wasn't so surprising. What was really interesting was to find out guys' attitudes towards mental health. They see mental health as something overwhelmingly negative. It's only ever associated with problems, and problems at the extreme end of the spectrum. It's not something to be talked about because it's associated with weakness, and it's something that they don't really know about or want to be proactive. So it's very different to the way that they think about physical health. Furthermore, guys stereotype teenage girls and older men as being those who are most affected by mental health. So essentially they don't see their demographic as being particularly affected, which is problematic in that if they were to be affected, they would probably feel quite isolated. So there's a real lack of awareness, not only about what mental health is, about how to maintain good mental health, but also who's affected by mental health, and really how common some of the problems are, and how much it's a thing that happens to a lot of guys. They don't really want to talk about mental health in the terms that are currently being used to talk about it. They want a new language. They don't feel empowered to talk about it because they don't want to use words like depression or schizophrenia or anxiety or these sort of more medical or academic terms. So they're really looking for their own discourse to be to facilitate them to even open up the discussion, and maybe later on down the track identify the more serious conditions. But at least from the outset, there's a real barrier there in terms of we can't talk about mental health because the words that we currently have to describe it are quite extreme. They're also extremely distrustful of the professional services such as counsellors. They don't think that counselling is going to help. They're sceptical as to whether it is good value for money. They're sceptical about whether or not the counsellor is indeed qualified to help them. And they're also incredibly concerned for their reputation when addressing any form of mental health issue. Like I mentioned before, mental health is associated by and large by young guys with femininity and weakness. So unless those stereotypes are sort of addressed and unless guys feel comfortable, a lot of reputation is at stake. I was a little bit skeptical about the technology-based solution, which ultimately this project is all about. I didn't necessarily at the beginning make the connection between how technology could be used to overcome some of these problems, and that's probably as a result of that when I came on board to this project, I hadn't had a lot to do with mental health research and I hadn't had a lot to do with Inspire, which I think in the end was a really good thing in terms of making their results be really scrutinised and be really genuine. The barriers which they described are ideally suited to some form of online technology which allows them to seek help and in their own time, conveniently, and most importantly anonymously. So having done all this, now we have all these insights, what can Inspire now do? I remember the day when I'd brought all the research together and I'd been transcribing for 2 weeks straight, and I was, like I said before, immersed in the data, and I presented to all the staff at Inspire, and the minute when I finished my presentation, the guys from the digital team came up to me and they were like, "Are you in tomorrow? Can we get started on this tomorrow?" Basically wanting to start working on designing what the website would look like, what kind of mobile phone services or what kind of digital campaigns, how that would sort of happen. And I'm enormously supportive of that. Having done this research, I think there's a lot to be done there, and a lot to be done really well. There's a lot of new, innovative things that can be done to basically make an online space that guys are comfortable visiting, design online campaigns that promote awareness about mental health, break down the stereotype that mental health is an issue just for girls.